Hello, my name is John Augustine from WellNet, and today we're going to discuss how one of the key aspects of healthcare reform, specifically the medical loss ratio requirements, can cause a fully insured carrier to actually avoid preventing illness, which we all know is the real key to lowering healthcare costs. Let's start with an overview of the Affordable Care Act as it relates to fully insured versus self-funding. You may have seen a grid similar to this in the past, but this is referring to the problem that exists as it relates to the affordability of health care. If you think about the Affordable Care Act and why it was really passed, there were two core concerns that the government was trying to address: accessibility to health care and affordability of health care. I think everyone would agree that from an accessibility perspective, they have succeeded with the expansion of Medicaid, the state-based exchanges, the federal exchanges, etc. Where the Affordable Care Act has failed is in its ability to actually address costs. Remember that what drives health care costs are claims. If you're not addressing claims, you're not addressing costs. It's really that simple. The Affordable Care Act was passed in 2010, and it's quite a complex law, as you know. There's thousands and thousands of pages of text. This picture that you're seeing here was actually presented in several newspapers across the country right after the law passed. And again, it's tough to understand the law. So what WellNet's done has taken the major aspects of healthcare reform and boiled them down to one simple page here. While I could talk about a number of these things in detail, the main topic of today's conversation is medical loss ratio. So let's just get right into that. The way the medical loss ratio rule works is for every dollar of premium charged by the insurance company to fully insured groups, every dollar that goes out the door, or that comes in the door, 85% of that has to go out to pay a claim. So of all the premium charged by the insurance company on a fully insured group, 85% has to be earmarked for claims. The carrier can only retain 15%. Very simple. That means that the carrier's total revenue is limited to 15% of premium. Now, I want you to think about who your insurance carrier is. In many cases, it is a publicly traded company. And the shareholders of that publicly traded company are going to expect and demand that that insurance carrier generates more revenue next year than they generate this year. But the way the medical loss ratio rule works is the carrier can only retain 15% of your premium. And that's for groups over 50. For groups under 50, they're allowed to retain 20%. So let's keep this over 50 for now. So for every dollar that gets taken in, the carrier can only keep 15 cents. So as a shareholder of a publicly traded insurance company, how on earth can my insurance company generate more revenue next year? As I see it, there's only three ways to do it. They can reduce the amount of services they're providing, which means that the 15% they're earning on the premium will generate more profit because they're not giving you any services. That's not ideal. Neither you nor the insurance carrier wants that. Option two, they can sell more lives. They can insure more people. And that is happening through the exchanges and the expansion of Medicaid. There's no doubt. But that's not going to generate double-digit revenue growth. The third way, and this is what's happening today, you know it in your own plans, is that the carrier continues to raise rates. If they raise rates, then their 15% share generates more revenue. Now think about the law, though. The reason the law was passed was so that the insurance carriers could not arbitrarily raise premiums. In order to raise premiums, they have to prove that more than 85% of the premium they charge paid claims. If their loss ratio is unfavorable like that, they're allowed to raise your rates. So I challenge you to think about this right now. How does that possibly benefit you as a fully insured client? Because financially, it benefits the insurance carrier to raise your premium. That's really the only way they can make more money. But the only way they can raise your premium is to let your claims go up. That's a perverse model. The law set out for a good reason, but inadvertently they've created a financial incentive to ignore the health of your population. The sicker your people get, the more the premium can go up for the insurance carrier, which means the higher their revenue. Wouldn't it be more appropriate if all stakeholders involved, that's you, your employees, your insurance partner? Wouldn't it be more beneficial if we were all incentivized to lower claims rather than raise them? I mean, think about it. If your employees were perfectly healthy, your healthcare costs would be next to nothing. Let us help you build a plan that incentivizes stakeholders for all the right reasons, not the wrong reasons. At the end of the day, healthy employees are more productive, they come to work every single day, and they cost virtually nothing to insure. So the question is simply, how do we improve the underlying health of your population? We welcome a conversation with you to discuss how we at WellNet can help you to create a more sustainable healthcare plan. Learn more by visiting us at wellnet.com, or you can call me anytime on my cell phone at 610-348-6804. Thanks so much.